dahil patuloy ang pagtaas ng mga gumagaling. Nasa 1,109,226 na po ang bilang ng mga nakarecover. Samantalang, malungkot naming binabalita na nasa 19,951 ang binawian ng buhay dahil sa coronavirus. Nakikiramay po kami. Nasa 1.69% po ang ating fatality rate. Ito naman po ang kalagayan ng mga ospital natin at ang ating tinatanong palagi, sapat pa ba ang ating mga kama? Unahin natin po ang Metro Manila bago ang buong Pilipinas. Yung sa infographics natin ng bed capacity, bago po tayo magtapos ay babasahin lang natin yung infographics ng ating healthcare utilization rate. Babasahin ko na po sa aking cellphone dahil alam nyo naman po, nasa probinsya tayo, we are improvising. Okay, dito po sa Metro Manila, sa pagdating po sa ICU beds, 60% po ang ating utilized ICU beds. Sa ating isolation beds ay 41% po ang utilized. 40% naman po ng ating ward ICU beds ay 59% utilized. Ang ating ventilators ay nasa 39% utilized. Okay, dito po nagtatapos ang ating press briefing. No? Kasama po natin si WHO Dr. Rabindra Abeyasinge at saka si Dr. Edsel Salvania. Now, good morning. Siguro po, unahin muna natin si Dr. Rabi.
Good morning po.
Dr. Rabi,
good morning.
Many Filipinos, particularly the middle class, are alarmed with government's pronouncements that Pfizer with facility, no? Can you explain to the Filipino people why this is the case? Why we cannot give Covax the A5 or the indigent population? The floor is yours, Dr. Rabi.
Thank you so much, Secretary Spokesperson Harry Roque. It's a pleasure to be here, and thank you for this opportunity. Let me clarify the Covax facility committed to provide vaccines to cover 20% of the population of the Philippines and indeed all countries that signed on to the Covax facility. And that 20% of the population was determined to be the frontline healthcare workers and the elderly population. And the reason for that was that this prioritization was based on the SAGE recommendations from WHO, so that the Covax facility vaccines are used to maximize the impact on fully protected and reducing congestion in the hospital settings. So our position has been and continues to be that the vaccines coming from the Covax facility, which is a facility set up through contributions, overseas development assistance, bilateral donations to support low and middle income countries. So we need to prioritize and follow the priority so that we continue to urge the government to follow the prioritization to ensure that we achieve high coverages in the A1 and A2 groups. We do understand that there is a need to start protecting the other groups, but when we see that coverage, particularly in the A2 group, is around 10%, it's still premature from our perspective to agree to use Covax vaccines to cover any of the other groups, because while recognizing that the other groups are important, it is clearly defined that the largest number of deaths and severe cases are from the A2 group. And so we continue to urge the government and the local government units rolling out Covax vaccines to ensure that they follow the prioritization to maximize the impact of the vaccines donated by the Covax facility. This is important because as we have seen with the recent surge, with the arrival of new variants, which will continue to mutate, this virus will continue to mutate. We need to ensure that the most vulnerable are protected adequately. Vaccines, and as we reach relatively high coverage, we can start looking at protecting other groups. But our position has been that we need to respect the prioritization simply to increase the impact that the vaccines are providing in regard to controlling this pandemic. Thank you.
Thank you very much, Dr. Rabi. Is there any updates on additional Chinese vaccines that have been included in the emergency use list of the WHO? And on the basis of the WHO EU list, can you explain to the people why the brand of vaccine to be administered to them really does not matter?
No, thank you again. This is a very important question. And regarding your first question, there are 2 Chinese vaccines that were being reviewed by WHO. These were the vaccines that have been provided to WHO for review. We've now completed the review of the Sinopharm vaccine, and this is now listed as a WHO EUL listed product. In the case of the Sinovac vaccine, WHO has sought some clarifications from the manufacturer, and we are waiting to receive that information. We believe that in the next couple of weeks, once those clarifications are received, the WHO will be able to reach a conclusion about listing Sinovac as a potential EUL candidate.
That all the vaccines that we're using in the Philippines, including the Chinese vaccines, will be or are already included in the WHO EU list?
Well, if Sinovac is listed, then that will also receive UL status. We are still a few weeks away from the actual listing. It has been very clear that these vaccines are largely used to prevent severe disease and deaths. And we know that all of the vaccines are doing that effectively. Over the weekend, we saw even reviews saying that the Pfizer and AstraZeneca vaccines appear to be effective even against the Indian variant. That was work published by the Public Health England over the weekend. WHO is also looking at this data. But what is important is that from a point of view of preventing severe disease and death, all of the vaccines that WHO has listed under UL, what can be provided to countries based on the ground conditions, because some of these vaccines have very complicated storage requirements and shelf lives. So looking at that, we are looking at which vaccines can be provided and deployed to protect the largest number of people in each of the countries that Covax will be providing vaccines. Having said that, I want to reiterate that Covax has agreements for large numbers of doses with Pfizer, with Moderna, with AstraZeneca, our commitment to provide vaccines to protect the 20% of the most vulnerable, as was agreed when we set up the Covax facility.
Okay, thank you very much, Dr. Rabi. We now call on Dr. Salvania.
Good afternoon po, Sec.
Doc,
yes.
Marami pong nag-aantay ng mga favored brands nila, no? At hindi pa nagpapaturok. Ano pong advice nyo sa kanila? At meron ba hong nalalabag sa tinatawag na informed consent kapag hindi po inaanunsyo kung ano yung brand na gagamitin sa mga vaccination site, although bago turukan, i-reveal po sa mga tao kung ano yung ituturok sa kanila. The floor is yours, Dr. Salvania.
Yes po, Sec. Roque. Una-una, I think it's important that we remember that all the vaccines that have an EUA are very effective against severe disease, which is really the most important outcome para sa ating mga bakuna dahil alam naman natin ang COVID 10 to 20 times more deadly than the flu. Yung flu, ang dami-dami every year pero konti lang relative to the number who get sick ang namamatay. So yun po talaga yung objective, itong COVID, gagawin natin parang flu or even less at para makapagbukas na po talaga tayo ng ating ekonomiya at ng ating bansa. So in terms of vaccine you can get is really the one that is there already. Dahil of course, if you wait for your preferred brand, baka hindi na maghintay yung virus bago ka ma-infect, and if you get infected, you can die. So it's very, very important to understand yung risk ng isang bagay po talaga yung difference na yon. Now, in terms of yung consent, as long as alam naman ng tao kung ano yung ituturok sa kanya, before iturok sa kanya, I think that's enough. Pwede naman siya talaga mag-refuse at that point. I think ang important lang talaga is we have to observe yung minimum health standards natin during yung vaccination campaign dahil nakikita natin nagkukumpul-kumpul yung mga tao eh. So very important talaga that we avoid crowding during the vaccination process and sundin po natin yung mga pre-registration na patakaran. At yun nga po, safe and effective naman po lahat ng bakuna and we urge everyone to get whatever vaccine is there because they all work.
Maraming salamat, Dr. Salvania. Sana po nakuha natin ang mensahe. PGH na po yan, Dr. Salvania. Pareho naman po ang sinasabi nila, no? Lahat ng bakuna po dumaan sa masusing pag-aaral, either po sa parte ng Philippine FDA o ng WHO, no? At napatunayan na ligtas at epektibo ang mga bakunang ginagamit natin. Okay? So tumuloy na po tayo sa ating open forum. Yusek Roque, go ahead. Please ask the first.
Katarong na SMNI News, komento po sa panukala ng isang senador na magkaroon ng mas maraming PGH sa iba't ibang parte ng bansa para hindi lamang tayo umaasa sa PGH Manila. Mas maraming masiservisyohan kung may access sa ospital ang ating mga kababayan sa 4 na sulok ng bansa.
Sang-ayon po tayo dyan, no? Pero nais ko lang pong ipaalam sa inyo, ang Department of Health, galing po yan sa budget ng UP. Nung ako po ay nagtuturo ng 15 taon sa UP, talaga naman pong mayorya ng aming budget sa UP ay napupunta po sa PGH. So ginagamit po kasi ng UP system ang PGH bilang isang teaching facility, no, para sa mga estudyante ng medicine. Now meron naman po talaga mga plano na magkaroon ng karagdagang mga Philippine General Hospital. Meron na pong plano na magtayo ng PGH dyan sa Diliman na mas malaki, no? Hindi po ako nagkakamali. 3,000 rooms po pinaplano nila. At may plano rin po ngayon, no, sa drawing board na magkaroon ng PGH sa iba't ibang campuses ng UP system. Meron pong mga campus ang UP sa Cebu, sa Iloilo, sa Davao, among others, no? At saka meron din po yan sa Clark, Pampanga.
Opo. Susunod pong tanong mula kay Chris Jose ng Remate Online. Opo, I'm sorry, Secretary.
Reaction. Go ahead, please.
Reaction po sa napaulat na may nagbebenta ng bakuna o pag-aalok ng slot sa COVID-19 vaccination program sa halagang 15,000 o depende pa po sa brand. Ano ang gagawing hakbang ng gobyerno sa bagay na ito? Ganito rin po ang tanong ni Ivan Mayrina ng GMA News.
Well, yan po ay pinagbabawal. Wala pong bakuna na binebenta dahil wala pa pong bakuna na binigyan ng commercial use pa lamang. Hindi pa po tapos yan sa 4th clinical trial. So kapag kayo po ay nahuli na nagbebenta ng bakuna na wala pang commercial use, pwede po kayong makulong sang-ayon po sa bataas na nagbuo ng ng Food and Drug Authority sa Pilipinas. Kasi meron po yan tinatawag na penal clause, no? At yung naman ng mga nagbebenta ng slot, yan po ipinagbabawal din natin, no? At pwede po tayo rin ma-prosecute para po dun sa paglilinlang na krimen, no? Kasi wala naman pong karapatan ng kahit sino na magbenta ng kanilang slot.
Okay, thank you, Secretary. Susunod po magtatanong si Mela Lesmoras ng PTV via Zoom.
Rabi. Secretary Roque.
Rabi, please.
Yes,
Okay.
please.
Go ahead.
Dr. Rabi, my first question po, do we have any information when can we get new supplies of COVID-19 vaccines from the Covax facility? Any specific dates, what brands, and how many doses po?
Thank you for the question, Mela. What we know is that we are expecting up to 2 million Pfizer doses to come in before the end of June. It may be as early as within the next 10 days. We don't have specific dates at this point of time. We are not clear whether all 2 million doses will come in one shipment or we are to expect 1 million doses first and the next one later on. And we also expect about 2 million doses of AstraZeneca to come in within the month of June. So that's what we have right now. That is earmarked for the Philippines from the Covax facility.
Okay, thank you so much po, Doc Rabi. For Secretary Roque po. Hi, Spokes, do you hear me po?
Yes, I can hear you. Go ahead.
Opo. Secretary Roque, ano pong masasabi ng Malacanang dahil nga may mga naitatalang COVID-19 surge sa ilang panig ng Visayas at Mindanao and dito naman sa Luzon, may mga naiulat na super spreader events. Is this a cause of alarm at imbes na pa new normal na, maaari po bang maghigpit ulit ng quarantine nationwide dahil dito?
Well, hindi ko nakuha yung last part ng tanong mo, pero yung first part ng tanong mo, alam niyo po, nakakalungkot na matapos ang mahigit na isang taon, napakadaming napapaulat ng mga super spreader events. Mga kaibigan, habang hindi pa po tayo nagde-develop ng population protection, yung dating tinatawag nating yung population na ay sa minimum health standards. Alam ko po napapagod na kayo, pero nag-antay na naman tayo ng mahigit isang taon na, bakit hindi na lang tayo mag-antay ng kaunti na lang pong buwan, no? Ang target naman po natin ay 70% ng ating mga kababayan ay mababakunuhan by December. So ilang buwan na lang po yan. Sana po iwasan natin itong mga super spreader events na ito. Sayang naman po ang ating pag-iingat ng nakaraan kung babaliwalain natin lahat ngayon.
Opo. And a quick follow-up lang po, Secretary Roque, kasi isang linggo na lang ay magtatapos na rin naman ang buwan ng Mayo. Sa tingin niyo po ba makaka-apekto sa bagong quarantine sa June? Ito nga mga developments na ito, lalo na rin yung COVID surge sa Visayas at sa Mindanao.
Well, nakita po natin na ang Iloilo City ay linegal sa MECQ at nakita rin po natin na ilang mga probinsya sa norte ay naka-MECQ rin. No? So sabihin na lang natin na bagamat ang numero ay nag-i-improve sa Metro Manila Plus, yung mga ibang lugar naman sa Pilipinas ay parang nagkaka-experience na mga lalo nating paintingin ang mask, hugas, iwas.
Opo.
At bakuna.
And my final question po, Secretary Roque, kaya pangwaw at ano pong agenda at may public address din po ba mamaya?
Well, mamayang hapon po, ito nga po yung Regional Peace Council ng Region 7. No? At gaganapin po yan di Congress. Naghain din ako ng bersyon ng Maguindanao Compensation Bill. No? Ang pagsuporta naman po ng Presidente depende kung magkano talaga yung ilalaan. Pero sa ngayon po, bilyon-bilyon na po ang nagagastos ng gobyerno para sa rehabilitation po at rebuilding.
Makers for the President to certify it as urgent?
Well, titignan it's a matter naman for PL-ification to the President.
For Dr. Rabi, question from Laila Salaveria. What does he think of the Philippine government not to announce the vaccine brand in advance and only inform the recipient on the day of inoculation?
Thank you, Yusek Roque, for the question. I think this is a congestion at vaccination points when vaccine brands are announced. And we continue to say that all are receiving. And so we should try to manage these situations where people are congregating and creating situations where transmission may increase. And if not announcing the vaccine brand will help with that, I think this is a correct step in the right direction because this will help us to manage these kinds of super spreader events from happening, and will also encourage people to accept the vaccines that are being rolled out. So we are supportive of this effort.
Her second question based on her best practices observed by the WHO, what is the best way to convince people to get vaccinated against COVID-19?
Right now, we don't see a lot of. We know that the Philippines has traditionally had some vaccine hesitancy. What we are seeing now is that people demand. So it's not actually an issue of vaccine hesitancy. There may be in some places preference for brand A or B of a vaccine. That should not be interpreted as vaccine hesitancy.
Thank you, Dr. Rabi. Secretary Roque, question from Tricia Terada of CNN Philippines. I think wala po siya sa Zoom pero nag-send po siya ng question for Secretary Roque. Vice President Leni Robredo urges the government to do a multilateral approach to resolve the territorial dispute in the West Philippine Sea. She said the Philippines would not be able to protect its interest in the West Philippine Sea if we only do bilateral talks with China. The Vice President also cited experts' advice that bilateral talks with China will not help the country because the standing is not equal. What does the palace think about this? Is this something that has been done or considered? What's the outcome?
The President po is the lone architect of foreign policy. Hindi po totoo na hindi gumagana ang ating bilateral approach to the West Philippine Sea kasi matapos po ang halos 5 taon ng termino ng Presidente, wala po tayong nawalang teritoryo sa China, wala po tayong hidwaan sa China. So I beg to disagree.
Dolomite sand had been washed off in the sea. Is the President considering to order the stoppage of the Dolomite sand project and find ways to realign the budget to much more important and urgent needs?
Matagal na po nating nasagot yan. No? Yung budget po for sa Dolomite ay matagal na po yan nasa budget ng DENR. Hindi po yan bagong budget. At bagamat meron po tayong bayanihan law that allows the President to realign funds, hindi po applicable yan doon sa mga funds na nakomit na po. No? Meron kasi realign ng ilang mga pondo na hindi pa po siya na-align for a specific purpose. Pero ito po, completely bidded out and partially executed, so kinakailangan po tapusin yan.
Opo. From Red Mendoza of Manila Times, for Secretary Roque, pinapakalat ng mga ng mga taga-oposisyon sa social media na hindi raw papayagan sa Saudi Arabia at European Union ang mga nabakunahan ng Chinese vaccine na Sinovac o Sinopharm at ang papayagan lang ay ang Pfizer, Moderna, Astra or Johnson & Johnson. Gaano ito katotoo at nag-uusap na ba ang Pilipinas through DFA na maiwasan ang diskriminasyon laban sa mga Chinese na bakuna na ginagamit ngayon ng sandata para magkaroon ng vaccine hesitancy?
Wala pong basihan yung ganyang mga balita Kasi kakasabi lang ni Dr. Rabi na sa parte po ng WHO ay sinasama naman po nila ang mga Chinese brands sa kanilang emergency use list. No? Sa katunayan, nasa listahan na ang USEP kung bakit hindi tatanggapin ng EU at iba pang mga bansa ang kahit anong bakuna na nasa listahan po ng WHO mismo.
For Dr. Rabi and Dr. Edsel, right now, there are no cases of vaccine-induced blood clotting in the AstraZeneca vaccine in the country or in Asian countries, while there were cases in Caucasian countries. Do you think ethnicity has a link why blood clots are prevalent in these countries and not in countries with a huge Asian population, such as the Philippines? And for WHO, do you think it warrants a study, Dr. Rabi?
Thank you for the question. The incidence of at this point of time, we need to recognize that there are weaker systems in developing and low and middle income countries for monitoring of persons receiving vaccines. Having said that, we also recognize that many of those complications were seen among recipients of vaccines manufactured at different plants, Asia. So the vaccine was manufactured or whether it's related to ethnicity. But as I mentioned, this is a new problem. It's just a couple of months. It takes time to analyze the data. It takes time to understand the circumstances that link vaccine. So we want to reassure the people that WHO, with its research institutions and partner regulatory authorities in the countries that have reported such cases, and we are working with the Food and Drug Administration, for example, in the Philippines, to strengthen the monitoring to see whether such cases are occurring in the Philippines. So this is the way WHO is working around this problem, and as soon as we have clearer evidence, we will be happy to share them with the population. Right now, it's still an ongoing process. There is a lot of work happening, but we don't have clear positions or evidence linking and understanding the pathogenic mechanism of how this happens. Maybe Dr. Salmana can add to what I have just said. Thank you.
Right. Thank you, Dr. Rabi. There is yung incidence sobrang baba, no? It's about 10 out of a million is what they're seeing in terms of these blood clots. And so far, yung NAFIC natin, yung adverse events body natin for vaccines, are monitoring the patients who have gotten Astra and also all the other vaccines. Kasama naman po talaga ito sa ating pagbabantay sa pagbigay ng bakuna. But just to put it in perspective, diba, this is anywhere from 4 to 10 out of 1 million. If you get COVID, your risk of clot is 1 out of 3. So this is such a huge difference in terms of risk versus benefit that most countries that suspended their Astra have actually restarted giving it, including us, because the risk is much, much smaller compared to the benefit of these vaccines po.
Opo. Thank you. Yung second question po niya, Dr. Rabi already answered it. For Dr. Edsel, sinabi niyo na hindi na need ang pagkuha ng antibody count sa isang nabakunahan na. Ano ang ultimate sign na ang vaccine ay gumagana na sa katawan?
Well, ganito kasi. So the US CDC, Centers for Disease Control, has said that the antibody tests that people use, they're different kits. And the antibodies that you generate from vaccine are very, are very specific. Hindi yung buong virus, except maybe like yung Sinovac and Sinopharm na whole virus. For instance, yung Astra is spike protein lang yung hahanapin mo. So it may not test positive on our antibody tests. Second is, hindi lang naman antibodies yung batayan ng immunity sa katawan. More importantly is something called T cells, yung ating cell-mediated immunity. These are the soldiers of our body that actually look for virus that is hidden inside cells that have been infected. So even if your antibody test, so if your antibody test is positive after vaccination, great. Ibig sabihin, siguro nga gumana yung bakuna. But even if it's negative, it doesn't mean you're not protected because your T cells might be okay. And on top of that, we have the clinical trial data that shows that it is this percent effective, almost 100% for most, for severe disease. And the real life data, like for Sinovac in Chile, we have 10 million people who were studied, and they showed 85% protection against moderate to severe disease needing hospitalization. So it is this kind of data that is very, very reassuring na gumagana po talaga yung bakuna natin. So the bottom line is, you don't need to check your antibody levels after vaccination. It's not required. And even if you check it, if it's positive, great. If it's negative, it does not mean that you're not protected. Gagana pa rin po yung bakuna.
Thank you, Dr. Edsel. Dr. Rabi. Secretary Roque, ang next po magtatanong, si Melo Acuña ng Asia Pacific Daily via Zoom.
Good afternoon, Secretary Harry. I wish you the best in Dumaguete. The place is good. Enjoy the environment. My first question to you, Secretary Harry, there have been 1,000 still new COVID cases reported by the Department of Health. Will the government reconsider its mandate to use face shields because it's additional expense? Secretary Harry?
Wala sa pag-aaral po, talagang nakakatulong po na makaiwas ang kaparehong face shield at saka face shield, no? Face mask and face shield. Yung face mask and face shield, no? So together, I understand the statistical the percentage of helping in avoiding COVID is almost equivalent to having a vaccine. So bagamat additional halos lahat naman po ng Pilipino ay meron ng face shield na hawak na nila, no? So yes, in the past it was an additional expense, but it was not too much compared to shield.
Yeah, okay. For Dr. Rabi and
Perhaps
Dr. Edsel, please.
I can add to this on the with Melo, si
Yes.
Dr. muna ha, si Dr. Salvania. Dr.
Sure.
Salvania, ano po yung pag-aaral? Ano yung percentage that people can avoid having COVID by wearing both face mask and face shield and observing social distancing again?
Right. So there's actually one paper from the Journal of the American Medical Association which specifically studied yung face shields sa healthcare workers in India before and after nagmask sila. When they did not use face shields, about 50 of them out of several hundred, I think, na community healthcare workers got COVID. When they started using the face shields, nobody got COVID. So that's the prospective data that supports face shield use. Now, there's also a paper from the Lancet Infectious Diseases na nagpapakita na ang effect ng mask is about, it decreases your risk by about 85%, especially if you're wearing yung mga surgical and medical grade masks. And then for, hindi naman yung sinabing face shield, but eye protection. Kasama na yung face shield dyan, it's about 78%. And yung physical distancing, at least 1 meter, is about 80%. And if we put all these together, it is more than 90%. And Dr. Dance and a lot of the other evidence-based medicine groups have looked at these studies, and they think that actually yung effect is above 90%, above 95% pa nga, if we use all these correctly and consistently. Yun po yung to get in.
Okay. Thank you very much for the clarification. For Dr. Rabi and Dr. Edsel, let me ask you, there are reports from India about the black fungus thing affecting COVID patients who recovered from COVID-19. Have you seen these traces of black fungus in the Philippines?
I can answer. So the black fungus is what we call mucor, and this is found in the environment actually. But it only happens in people where their immune systems are very, very bad. There's one term for this in the United States. In the Philippines, thank God, wala pa naman ako nakikita. But we have the means to culture these and detect these, and so far we have not seen it in our COVID patients.
I see. Dr. Rabi, your thoughts, please.
So there's a school of thought that the relatively high number of cases being reported from India is possibly also linked with the immunocompromised status because of relatively large-scale use of steroids in India. This is something we don't see in the Philippines, and we are glad that, as Dr. Salvana said, we are not seeing these cases here in the Philippines.
I see. From the outside looking in, Dr. Rabi, are you satisfied with the way the government is rolling out its vaccines and it adheres to Covax rules and regulations on the priorities?
Overall, we are very encouraged by the vaccine rollout. Over the weekend, I think we exceeded 4 million, and we are closing on 1 million people fully protected now. So this is very this country. And given that the performance has been very creditable and commendable, we are encouraged by what we are seeing. We recognize that there have been a few lapses, but those are not systemic lapses that have happened, but individuals violating the clear protocols that have been adopted by the National Vaccine Operations Center and the government. We urge stricter compliance with the protocols that have been defined by the government at local government level so that we can minimize those violations and ensure equitable access within the country to all people at risk.
Mm-hmm.
Nagkaroon tayo ng technical problem. Can we move on to the next question, please?
Yes. Secretary, just for you, let me just ask you, what assurance have we that the missed opportunities or missed spots, if you may, in the rehabilitation and the thing in Marawi could be met? No? We missed some opportunities already due to some budget before May 23, 4 years ago.
Well, ang pangako po ng Presidente, babangon puli po ang Marawi at ang pangako po niya ay sa kanyang termino. No? So we have a year before, roughly a year, bago po matapos ang termino ng Presidente. And I think the target can be met. No? That Marawi will be completely rebuilt at the end of the term of the President.
Thank you very much.
Matagal na po namin pinaplano na magkaroon ng press briefing doon sa Marawi para ipakita sa taong bayan yung progress ng rebuilding of Marawi. Hayaan niyo po, aayusin namin yan probably in the month of June.
Thank you. Thank you, Secretary. Have a nice day. Thank you.
Thank you, Melo. You too. Yusek Roque.
Okay, Secretary, from Ivan Mayrina of GMA7, game daw po si Vice President Leni Robredo. Secretary. Second question.
Sagot ko, no? Tapusin ko muna yung sagot ko, no? A second part of the question is, yun nga po, no? It will depend on the President's assessment if the participation of VP Leni Robredo would be helpful in building vaccine confidence, no? Pero ang karanasan po natin, and this is backed up by a study by PSRC, yung pinaka-epektibo pong kampanya so far against COVID is mask, hugas, iwas na sa bandang huli naroon po ang ating Presidente.
Yung second question naman po, has a decision been made on the meeting with former President as an alternative to convening the National Security Council about West Philippine Sea? If so, what will be on the agenda and what is the expected output from it?
Lilinawin ko po, no? The President toyed with the idea. Kasi nga may nagsasabi na dapat i-convene ang National Security Council daw. Pero ang sabi ni Presidente, yung mga pagkakataon na naka-attend siya ng National Security Council, wala namang naresolba. But itong possibility nito was before Senator JPE shared his views on the WPS. Pero mukha namang after JPE concurred that the President is pursuing the right policy on the West Philippine Sea, wala naman pong urgency na pag-usapan itong bagay nito either with the National Security Council or with the former presidents. No? So this is not a done deal po. No? It was something that President was speculating on before JPE fully concurred with this policy on the WPS.
Opo. Pahabol po ni Ivan Mayrina, I think for Dr. Edsel or Dr. Rabi, is there new data to show how long the effectivity of vaccine lasts? How long are we protected?
Doesn't well, the clinical trials are still ongoing. Yung long-term follow-up nila. So at about 8 months, most of the vaccines is where we're at, and it seems like most vaccines have very robust antibody responses, and we expect that these will continue to protect people. So ongoing yung studies. The issue of whether people will need a booster or not, that's still up in the air. That's not a done deal. There may need to be a booster, especially for mga variants of concern, although the latest data shows Pfizer and Astra seem to work against the variants from India and the variants from first discovered in the UK. But again, this data needs to be looked at. You can't just say, oh, we definitely need a booster or we definitely need something for the variant. So pinag-aaralan pa po, but the data is encouraging na.
Okay. From
Sorry, thank you. This is an ongoing process, as Dr. Salvana pointed out. We are collecting the data to know how effective the vaccines will remain for what period of time. And we are virtually still in several months of data that we have. And what is clear is that the vaccines are effective and they continue to protect. But how long they will protect, we don't know, because only time will show that. The other question is, will they continue to protect against some future mutant variants that will arise? We don't know the answer to that. So there are still unanswered questions. What we know is that the currently available vaccines are doing their job. They are protecting people from severe disease and death, and they seem to be giving good protection for what, as Dr. Salvana said, we have data now up to 8 months. But as time goes by, we will see whether there is evidence of immunity varying that may be against the existing variants, or there may be a situation where a potential new variant appears where we don't have protection again. Work on and try to understand as we roll out the currently available vaccines. Thank you.
Thank you, Dr. Rabi. From Maricel Halili of TV5, Secretary Roque, 42 health workers in Indonesia believe infected with COVID after getting in contact with Filipino crew members. They treated when the cargo ship docked in Central Java last week of April. Said the ship is believed to be en route to Manila. What's the directive of the government?
Well, dapat po sana ay pinagbigay alam na ng mga health officials dito sa health officials natin kung talagang papunta po dito yung barkong yan. Pwede bang malaman kung anong pangalan ng barkong yan para kung hindi pa po alam ng ating mga health official dito sa Pilipinas, magkaroon na po ng preparasyon sa pagdating?
Opo. Tanong naman po, wala naman po nilagay na barko. Na yan. Opo, Secretary, wala po nilagay na barko si Maricel Halili.
Pakitanong na lang po dun sa... Maricel, pakisabi lang po kung ano yung pangalan ng barko nang mabigyan po natin ng timbre ang ating kinakaukulan dito sa Pilipinas.
Okay. From Rosalie Cos of UNTV, habang bumubuti ang sitwasyon ng COVID-19 sa NCR, palala naman sa ibang probinsya, punuan ng mga ospital sa Cagayan de Oro, Negros Oriental at Iloilo City. Ano po ang ginagawa o gagawing aksyon ng IATF at NTF dito? Magpapadala ba ng karagdagang health workers para sa augmentation gaya po sa Puerto Princesa City?
Walang Puerto Princesa po, pinuntahan na ng NTF, no? At nagbigay na sila ng rekomendasyon, nagbigay din po sila ng mga additional antigen, at syempre po, yung pagbabakuna ay pinapabilis na rin, no? Lahat naman po ng rehiyon ay binabantayan ng ating IATF at ng DOH. Bagamat ang classification po ay monthly, napapansin nyo po na may mga ibang mga lugar na ilinalagay na po sa higher quarantine classification dahil nga po bantay sarado po ang ating DOH sa mga datos. At hindi na po natin inaantayan ang susunod na meeting ng IATF kung merong talagang pressing reason para ilagay sa mas mataas na quarantine classification ang isang lugar sa Pilipinas. Yan po yung nangyari sa Iloilo City lately. So bantay naman po talaga sarado ang ating DOH at IATF, at bukod sa higher classification, nandyan po yung mga additional testing na po pwedeng ipadala ron, yung additional vaccines na po pwede ipadala sa mga lugar na ito. At siyempre po, learning from the experience of Cebu, kung talaga nagkukulang po talaga ang health professionals, a-apply din po natin yung Cebu formula at magpapadala rin tayo ng mga temporary health professionals to reinforce our medical frontliners in these areas.
Second question po niya, ano daw po ang reaksyon sa apela ng medical frontliner sa Negros Oriental na humihiling ng ECQ? Gaano kabilis na didesisyonan ng IATF ang mga umaapelang LGU sa kanilang risk classification? At ano ang proseso bago maglabas ng desisyon?
Mabilis naman yung proseso, hindi na po inaantay ang meeting. At ito nga po yung nangyari sa Iloilo City, no? Basta titingnan natin ang 2-week average daily attack, yung daily attack rate, at saka yung hospital care utilization rate, no? Kung talagang nasa critical po pareho, ay po pwede naman pong iakyat kaagad ang quarantine classification.
Opo. Ang third question niya, paano matitiyak na hindi lang nakatuon sa NCR ang response ng gobyerno at hindi napapabayaan ng mga pinakaapektado ring probinsya?
Walang patunay po dyan ay yung mabilisang pagpalit ng quarantine classification, no? Hindi na natin inaantay yung once a month, no? Hindi lang naman po sa Iloilo nangyari ito, nangyari rin po ito doon sa mga probinsya sa norte, no? Na maski hindi na nga hinihingi ng mga lokal na pamahalaan, ay nagdedesisyon na kaagad ang IATF. Now, lilinawin ko rin po, bagamat ang pinakamaraming kaso ng COVID ay nasa Metro Manila Plus, 42% at most po ang linalaan para sa Metro Manila Plus, no? Yung karamihan pa rin, around 58% ng bakuna will still be distributed to the rest of the Philippines.
Opo. Secretary, may pinadala pong news si Maricel Halili na yung pangalan po ng ship isa daw pong Paname sa pinadala po niyang link na news mula po sa Straits Times, Panamanian flag cargo ship Hilma Bulker. Ang sinabi po dito, cargo ship.
Pagbibigay, alam po natin kaagad yan sa ating Coast Guard, sa Navy, at sa ating DOH.
Opo. Tanong mula kay Lanes Capanti ng GMA News Online. You have said that Filipinos should not be choosy when it comes to COVID-19 vaccine brand because all vaccines approved by FDA are safe and effective. Why should Filipinos get vaccinated with brands issued EUA by FDA when the President got a Sinopharm vaccine which is yet to be issued EUA by FDA? Do we apply different standards for the President?
Let's put it in context, hindi po namili ang presidente ng stateside na brand. Ang pinili po niya, Chinese brand din. At ang problema natin ngayon, tila marami talagang gusto stateside na mga bakuna. So I think yung pagpabakuna ni presidente ng isang Chinese vaccine will also bolster confidence dun sa mga Chinese-made vaccines.
Opo. Secretary. From Roy Mabasa of Manila Bulletin for Dr. Rabi, the Philippines recently received 193,050 doses of Pfizer biotech vaccine through Covax facility, WHO, and were apparently distributed to different LGUs. How do you sanction LGUs who allegedly misallocated the limited doses of Pfizer jobs and used them exclusively to inoculate barangay chairmen and their spouses with only less than a year to election? There is now a growing fear that vaccine can become a political tool, especially for incumbent officials. What mechanisms do you have to prevent this from happening?
Thank you, Yusek Raki. I think I already addressed this. Our position is clear. We have advocated that the use of the Covax vaccine should be to complete vaccination of the priority groups. In this case, we are talking of the A1 and A2 groups, which were earmarked for receiving this prioritization. The fact that some LGUs allegedly used it to vaccinate their local chief executives, since this is not something that we are aware of, this is something that should be managed by the national government rather than WHO. We would like to see this not happening. If it happened, we don't have the evidence that this happened, but if there are rumors that such things are happening, we would continue to advocate that the prioritization is respected. Thank you.
Thank you, Dr. Rabi. For Secretary Roque, how will the palace hold accountable LGUs who take advantage of the vaccination to advance their 2022 political ambitions?
Alam niyo po, wala namang nag-a-advance ng political ambition. Kung hindi, we really have to work with yung mga barangay captain at saka mga mayors dito sa vaccination plan nito, no? Yung local vaccination drives po, mga lokal na pamahalaan po nagpapatupad niyan. Nagkataon lang po nakaposisyon sila. Pero tingin ko po, pagsubok talaga sa kanila yan, no? Dahil pag sila'y pumalpak, lagot talaga sila sa taong bayan, no? So kinakailangan gawin nila ang lahat ng magagawa nila para mapabilis ang pagbabakuna at para masunod yung order of priority ng pagbabakuna.
From Rose Novenario of Hataw, dahil pagmamayari ni Dennis Uy ang team corporation na Philippine partner ng Smartmatic, malaki raw ang bentahe ng administration candidates laban sa opposition bet sa 2022 national elections. Ayon sa CPP, may batayan kaya ang pahayag lalo na't kontrolado di umano ni Uy ang 90% ng malampaya na nagsusupply ng 1/5 electricity sa buong bansa.
Rose, wag mo nang pansinin ng CPP-NPA, binansagan na yan ng terorista. Hindi lamang dito sa Pilipinas, kundi sa iba't ibang parte ng daigdig. Pag pinag-usapan pa natin ang mga sinasabi ng mga terorista, pinasisikat pa natin sila.
Opo. Question from Ace Romero ng Philippine Star. Pareho po sila ng tanong din ni Pia Rañada ng Rappler. Is the President inclined to extend again the suspension of the termination of the Visiting Forces Agreement or will he push for a new deal? Diplomatic sources have been quoted as saying that contrary to the President's statement, the VFA is not up for negotiation and the U.S. is ready to leave if the President scraps the agreement. What do you say to this?
Ganito po yan. Alam niyo po, kapag ako nagsasalita sa larangan ng foreign affairs, kasi po talakin, wala pa talaga siyang desisyon sa VFA. Pinag-iisipan pa rin niya. Pero, of course, narariyan yung issue na kapag nagkaipitan, lalo na dito sa WPS, ang nasa isip niya makakatulong ba sa atin ang pagkakaroon ng at tanging presidente lang po talaga ang makakadesisyon kung magkakaroon ng bagong VFA o tuluyan ng ibabasura ang VFA.
Opo.
Let us wait for his decision.
Follow-up po ni Pia Rañada, when is the President expected to make his decision? Will he hold any meetings?
Sandali lang, no? Bago po magpatuloy, alauna na kasi magpapaalam na si Dr. Salvania. So, we'd like to thank you, Dr. Salvania, no? Okay, go ahead. Go ahead, Yusek Roque, but we have to end soon because the PMS is requiring us to be in the venue by 1 p.m., no?
Opo. Ang follow-up question ni Pia, will he hold any meetings with officials or experts to aid him in making a decision?
Alam na po ni Presidente kung ano mga bagay-bagay na dapat ikonsidera sa kanyang gagawing desisyon. Dahil matagal naman pong pinag-aaralan ni Presidente itong issue ng VFA at yung relasyong Amerika at Estados Unidos.
Opo. From Celerina Monte, so that is me, wala na po bang plano si
At
President?
Pilipinas.
Secretary, tinatanong ni Celerina Monte, wala na bang plano si President Duterte to consult with former presidents after former Senator Enriquez support on his stance regarding his policy on West Philippine Sea?
Yun pong ang impression ko. Kasi ang sabi nga niya, hindi na nga niya papansinin ng kanyang mga kritiko, no? At ang sabi niya talagang respetado ni Presidente yung opinion ni JPE sa usapang West Philippine Sea, no? So ang impression ko po, he's satisfied that his policy on the West Philippine Sea is correct and is working.
Opo, last na lang daw po, Secretary, may mga pahabol ni Heidi Sampang, marami daw po mga kababayan gusto magpabakuna na may comorbidities and allergy, ngunit walang pambayad para magpa-check up, para sa required medical certificate. Ano daw po pwedeng tulong ng gobyerno sa kanila?
Pumunta lang po kayo sa kahit anong health center at kumuha ng certificate na meron kayong mga comorbidities. O pwede naman yung ipakita yung inyong reseta, no, kung ano yung mga gamot na kinukuha nyo. Oo. So hindi naman po masyado stricto ang ating mga vaccination centers sa pagdating dito. Gaya ko po, no, pinakita ko po yung aking prescription, no. Tinanggap naman po yun, no, kasi nakapangalan ko yung mga gamot na iniinom ko.
Okay. Okay, thank you, Secretary Roque, Dr. Rabi, Dr. Salvana. Yun po yung mga questions natin.
Okay, maraming salamat, Yusek Roque. Thank you very much to our guests, Dr. Rabi of the WHO, Dr. Salvania. Thank you very much, Yusek Roque. At maraming salamat po, no? Unang-una dito sa Panda House where we are conducting our press briefing. Thank you to Rojani D and their family. Hindi lang po libreng venue yung binigay, meron pang libreng milk tea. At nagpapasalamat po tayo sa lahat ng mga opisyales dito sa Negros Oriental na pinangungunahan po ni Governor Ruel Degamo. Maraming salamat din po sa mga kongresista ng Negros Oriental. Nandyan po si Congresswoman Josie Lim Kaichong, si Congressman Arnie Teves, si Congressman Manuel Chiquiting Sagarbaria, and salamat din po sa Mayor ng Dumaguete, Mayor Felipe Remolyo. Sa ngalan po ng inyong Presidente, Rodrigo Roa Duterte, ito po ang inyong spokes nagsasabi, salamat Dumaguete sa mainit na pagtanggap muli kay Presidente Rodrigo Roa Duterte at wag pong mag-alala ang sambayan ng Pilipino dahil naririto na po ang bakuna. Malapit na po ang isang better Christmas. Magandang hapon po sa inyong lahat.
Thank you po.